In this week's Cardiology Countdown, we'll start with an interesting analysis of cardiovascular safety of NSAIDs. Now, this has been a hot topic since the COX-2 inhibitors and Vioxx as the first one identified with increased risk, but a growing recognition that there's increased risk really across the class, as is in the label. The current analysis in the British Medical Journal is a network analysis where it used only randomized trials, and hence the good non-confounded analyses, and did pairwise analyses of where there are data for the NSAID versus placebo or NSAID versus other comparators, and did a big web of what compares to what. And out of that, they found that, as had been seen before, all of the NSAIDs, with the exception of naproxen, were associated with an increased risk of cardiovascular death and of MI. And there, for the risk of MI, naproxen trended to be lower, although not significantly. Interestingly, for stroke, naproxen was seen to have a higher risk of stroke, although not significant, and so not completely in the clear. And so this analysis from randomized trials re-raised the issue that drugs that we take every day, like ibuprofen, may have increased cardiovascular risks on the basis of these randomized trials, and thus judicious use of NSAIDs is urged. At this week's number 2 spot is an interesting analysis in the European Heart Journal that correlated carotid intima media thickness with the syntax score. Now, there have been many prior studies looking at carotid disease versus coronary disease using 1, 2, and 3 vessel disease, but this more detailed analysis of the syntax score and the complexity of disease was found to correlate very well with the carotid intima media thickness. And so I think a useful corroboration of this non-invasive measure versus complex coronary disease. And at this week's number 1 pick is the new update for 2011 of the secondary prevention guidelines of the ACC and AHA. This is a simple document that has a 2-page list of the key things to do. Diet and exercise, weight reduction are key factors in this secondary prevention guideline. There have been some updates, some adjustments to the antiplatelet therapy with the addition of prasugrel and ticagrelor for patients with ACS, especially those who have been stented. And there, in the post-ACS stented patient, recommendation for 1 year of dual antiplatelet therapy for both bare metal and drug-eluting stents. And then real questions about what to do beyond a year have remained and are being addressed in large trials. And so for this week's Cardiology Countdown, I'm Chris Cannon.